Imagine a previously healthy middle schooler walking down the hall between classes. Without warning, their legs give out, dropping them straight to the floor. The panic sets in immediately. A frantic trip to the emergency room follows as severe symptoms emerge: blurred vision, slurred speech, and sudden non-epileptic seizures. Hospital specialists launch an exhaustive search for the cause. They run MRIs to scan the brain, CT scans to check for swelling, and EEGs to monitor electrical patterns. Yet every single test comes back perfectly normal. There are no tumors, no lesions, and zero signs of structural disease or physical brain damage. In almost any other medical situation, a clean scan is a relief. Here, it is terrifying. The symptoms persist, but without a visible physical cause, parents are left without a medical path forward. This specific medical mystery has a clinical name: Pediatric Functional Neurological Symptom Disorder, or FNSD. If a child you love is going through this, you need to know their experience is completely real. The paralysis, the tremors, and the sensory changes are genuine physical events, and the child is entirely incapable of faking them. Traditional medicine struggles here because it is designed to address structural damage. When the scans show healthy anatomy, families are often discharged without a treatment plan, creating a dangerous and isolating care vacuum. To understand what is happening, we have to look at the invisible pathways the brain uses to transmit information to the body. The physical brain structures, the hardware, remain healthy and intact. The disruption occurs in the electrical signaling, the software, with commands beginning to loop, halt, or scatter as they travel through the nervous system. This signaling disruption causes the brain to transmit incorrect operational commands. That localized transmission error directly triggers the physical paralysis, the tremors, or the seizures. Standard imaging technology, like an MRI, takes static pictures of anatomy. It captures the physical structure, meaning it often misses a functional signal error in progress. These errors typically emerge when the nervous system becomes overloaded. Extreme chronic stress, unmanaged severe anxiety, or sudden traumatic events can push the brain's processing capacity to its limit. When the brain reaches a point where it can no longer process intense psychological weight, human biology may intervene by converting that emotional distress into a severe, uncontrollable physical disability. Because the root cause doesn't show up on a scan, these children face a pervasive stigma. Well-meaning adults and even some doctors often dismiss these severe symptoms as being imaginary or all in their head. Doubting a child during a neurological event has severe medical consequences. Shaming or accusing them of faking directly amplifies their nervous system stress. This disbelief creates a vicious cycle. The added stress triggers more misfires, transforming a treatable emotional overload into an escalating long-term physical crisis. Breaking that cycle requires stepping out of the diagnostic testing loop and moving toward active neurological rehabilitation. Since the underlying physical pathways are healthy, the brain retains its capacity to retrain those faulty signaling loops. With the right clinical support, recovery is a realistic and documented goal. Recovery requires a coordinated, multidisciplinary intervention. It specifically combines cognitive behavioral therapy to address underlying stress, working in tandem with physical and occupational therapy to retrain the body. Clinicians rely on compassionate reassurance, consistently validating the child's physical reality while simultaneously helping them target the root psychological triggers. This coordinated effort helps the nervous system re-establish clear communication, eventually restoring the child's ability to move, speak, and function normally. For families in Georgia, this multidisciplinary care is accessible through MentalSpace School, which builds this clinical infrastructure directly into the school environment. They provide rapid response care for K-12 students, including same-day teletherapy led by a diverse team of licensed clinicians. This focus on functional wellness produces clear results. Students receiving this specialized intervention show an 89% improvement in attendance and a 92% reduction in reported anxiety. MentalSpace School is designed to be accessible to everyone. There is a $0 cost for Medicaid patients, and they accept most major insurance providers, including Blue Cross, Cigna, and Aetna. If a child you love is suffering from unexplained physical symptoms, You can connect their primary medical providers with licensed therapists today by visiting MentalSpacesSchool.com. Sudden physical symptoms are terrifying, but when we treat the nervous system with the specialized, compassionate care it needs, a full recovery is possible.